A term that I often come across is polycrisis. That's the world that we're living in today, where different crises seem to exacerbate one another, and many communities can't recover from one emergency before another one begins.
Climate change has already impacted the health of millions of people around the world. We also know that it's happening here in Canada. It's not something that's happening in other places or other countries, it's happening in Canada. Just 2 years ago, Health Canada released a climate change and health assessment that showed that the health of Canadians has already been impacted by climate change.
Addressing these challenges requires collaboration at all scales, and everyone is going to have to play a role in helping mitigate and adapt to climate change.
Public health needs to be at the table for interjurisdictional and intersectoral collaborations to put health at the center of climate action and to put building community resilience at the core of what we do.
That's why we're all here today. Addressing the intersection of climate change and health will require us to reach across disciplines and from strong community partnerships. And we heard that from Elder OJ today as well, the importance of partnerships and relationships.
I'm super excited to welcome our case study presentations, which are going to highlight many inspiring and innovative climate change and health actions from across Alberta and from across many different sectors.
As a city, we've advanced on a number of fronts, in particular land use policies, which is arguably the most important climate action tool municipalities have.
When it comes to First Nations perspectives and working with non-First Nations, I think there's a lot of, from both areas, is that we have a lot of unlearning to do, as I call it, or maybe it's misinformation. But what are ways that we can work together to really have that understanding and that full, where you're coming from, but also what was being taught, what lenses are we bringing forward to this perspective?
We know that a lot of climate change and health solutions actually happen outside of the health sector. So that's things like food security, water security, access to green space and blue space. All of these things are really important for human health, especially in the context of climate change.
And I'm so pleased that today, the Climate Change and Health Hub will be officially launched. Studies show that one of the most impactful ways to help people understand what climate change means is through the lens of health. So the introduction of this hub is the perfect answer to this need.
Intersectionality and multidisciplinarity are not something that can be ignored. There's nothing in our world that the climate crisis doesn't touch.
At the city, we like to say every decision is a climate decision. I also think every decision is a health decision. We cannot, solve all these challenges on our own.
And that's why we're here today, to showcase examples of the work that is happening across Alberta to support communities as they prepare for and respond to climate-related emergencies and climate-related impacts.
Let's build relationships. We have an innate built in us to be kind, not only to each other, but to the planet.